very good morning from Johannesburg, South Africa. We're coming in live from different parts of the continent, including Africa. Really, really excited to be joining in today with my co-host, Joab Wako. We're part of a broader team with NCDChild, young leaders, including Apuva, Bulindi, and Alex. And we've come to the end of our podcast series. It's been such an insightful podcast series where we've spoken to patients living with non-communicable diseases, and we've also spoken to caretakers. And over the period, we've unpacked what are the experiences of stigma and discrimination, and what are the actions that we can take around stigma and discrimination. We know in the field of HIV, for example, that stigma and discrimination has quite a bit of focus, programming, and investment. But when it comes to non-communicable diseases, this is something which is still relatively novel, emerging, and an issue which really requires focus and attention. And so we're in conversation today with actually one of our fellow young leaders, Majed Mohammed, and he's going to take us through some of his experiences working on the ground level when it comes to stigma and discrimination. So thank you for tuning in. Majed, over to you to give our listeners an introduction of yourself. What's your relationship or work with the field of non-communicable diseases?
Right. Well, first of all, thank you so much for your kind invitation, and it's a great pleasure to be part of today's interview. So basically, I work at the Friends of Cancer Patient organization, where we work is basically focused on supporting cancer patients either financially and morally throughout their journeys, as well as working on community awareness programs and campaigns to raise the awareness that's surrounding cancer, and trying our best to minimize the misconceptions that's surrounding cancer in our community. Aside from that, we have also been working on advocacy work either nationally and globally when it comes to hosting or co-hosting many conferences, forums, and through such platforms, we ensure that we engage patients in a meaningful way, that their voices that are being heard and accepted and formulated in a way that is heard by the policymakers and decision makers, to hope that with the ultimate hope that they are addressing their challenges in a way in a form of a policy making or policy shaping that is best aligning with their needs and expectations.
Thanks, Majed, for sharing the work that you're doing, and it's a very important work. So I'd like to delve a little deeper into the stigma and discrimination. So as a healthcare professional or a caregiver, could you share more about stigma and discrimination that you have witnessed personally?
Yes. So, and it's really unfortunate that, despite all the advancement that we have established throughout the years when it comes to, improving the healthcare system and, intensifying our work in the awareness campaigns and the programs that we have been working on launching, either, as part of the, our work in the FoCP or from the Young Leader programs, there are still people who still believe that cancer, is a taboo topic. It's a death sentence. That's the unspoken disease. So the mind change and the mind shift is not easy to address. Or, for example, if we are going to discuss the stigma for in the workplace for cancer patients and survivors from experience, many patients feel that when they're getting back to work after getting diagnosed, they feel this kind of I wouldn't say empathy as much as the perception that cancer patients are not capable enough to handle certain types of work or tasks that has been handed over as they used to do before. So that's a huge misconception that having a kind of NCD makes you incapable and unable to fulfill your job and tasks that has been handed over to you. Another thing that's, surrounding cancer that we feel is for example, when women, breast cancer, of course, has been, a taboo topic for many, many years. However, we have been able to change the community perspective surrounding breast cancer through our initiatives. However, when it comes to cervical cancer, there is some, fear and some hesitancy of women to go and get themselves checked. Either because of the fear that, if I'm getting cervical cancer, the reputation might be affected in my culture, because usually cervical cancer is linked, with promiscuous behavior in some cultures. I'm not just, specifying the Eastern culture. I'm sure, in the Western culture, some stigma surrounding that area is still there as well. Another thing, some of them, when it comes to men cancer patients, when it comes to prostate and testicular cancer, some men, especially in the Eastern part of the world, men consider to be the supporters and the providers of the family, the breadwinners and their families. So having such kind of disease might, create this kind of, kind of that I'm unable to provide anymore. My children will not look at me as the role model as they used to do before. I'm weak. I'm unable to fulfill. I go out there and support my family. So there are many still stigma and misconceptions surrounding cancers. It depends on the cancer type, of course, but still it is there, and I'm sure it is a global issue. We cannot specify it, in a certain country or a certain region. Each country and each region have its own, the differences and disparities when it comes to their perceptions to NCDs and cancer, but it is still there and it's still a global issue.
Majed, I think it's really excellent to hear from you this morning. And as you sort of give us an overview of the different types of cancers, that it's not all linked together into just cancer, but what are some of the different types? What are some of the different patients and what are they going through as well? It would be very interesting for us to also, as Joab said, delve a little bit deeper. So, when we're talking about young children, adolescents, and young people, how do you see this playing out in your context in terms of stigma and discrimination, one? And two, you also live in a very interesting part of the world. So if you could give us a little bit more contextual information, that would be quite interesting. So in terms of, where do patients access care? How do they access care? Do they experience any stigma when they're accessing healthcare, for example? And also, what are some of the coping mechanisms that you're working on at the moment?
Right. So when it comes to children and adolescents, majority of cases that, we have been dealing with are patients who are affected by leukemia and, that are, majority genetically linked, diseases. So most of the time, these children getting their treatments at the hospitals. So it's really difficult for them to go outside, to live a normal life along with, their peers in school. They're not skipping school, skipping, sport activities and many other, what a normal child would do, going out there and exploring the world. So they are really just, getting their treatments at the hospital, and trying to cope with their situation. And we as friends of cancer patients, and I'm sure other cancer societies, try to lift up their spirits by conducting regular visits, bringing them gifts, including them in fun activities and exercises. However, you can only imagine, child that has been affected with such difficult disease, how impactful it is on his life at the early stages, and how impactful it will be on their lives in the future to come. So here we really try to emphasize on the importance of having a strong supportive system surrounding these children with cancer, because whomever are surrounding these children are their their village. They are the people who will either help them grow and overcome the disease, or break them down and break their spirits and result, and that can result in dysfunctional environment for them, that they will grow up feeling that they are incapable and they are weak, and the cancer has affected their lives in a way that is unpreventable, and they are unable to achieve their dreams and goals in life. So, so it is a very difficult and sensitive topic when it comes, to children with cancer. But we can do, as much as we can do as an NGO, as a patient organization. But I feel that, we really need to come together, across cultures, to raise awareness and spread more, information, and to minimize the misconceptions that are already there, and also stop judging people, with cancer, and just having the thought of, speculating the causes of cancer itself is a major issue. And actually, it feeds onto the stigma that is already there and can create more misconceptions surrounding cancer in the long run. So stop judging other people. Stop, trying to figure out why this person have got the disease in the first place. Because some people, unfortunately, in some cultures, link cancer with, for example, with karma, or with, you're getting cancer to pay for your own sins. You're getting cancer from an evil eye, for example. There are many, misconceptions that are out there. So really, to prevent such stigma, from the first place, I believe we need to stop judging others who are suffering, with NCDs and cancer.
Thank you, Majed, for that insight. As a person living with an NCD, it's really interesting that you've talked about culture and the important role that culture plays in perceptions or stigma and discrimination. I'm curious in terms of your experience seeing stigma and discrimination, and particularly caregivers. Let me just focus on caregivers, because I know the patients kind of take the center stage, but caregivers and their families, they also play a big role in the stigma and discrimination. So what have you done? What have you seen in terms of helping families and the people around them, the caretakers, deal with stigma and discrimination? Do you have any experience there?
Right. So, referring to what I was saying earlier, the people who are surrounding the patient throughout, their journey, they are their village, and they are the support system that, surrounds this individual with NCD. So, so really, I believe, from experience, many people, might not be fully aware about the appropriate approach when it comes to dealing with people living with NCDs, what to say and what not to say. I remember one of the ladies who were, coming to our office before, she was saying, I was going to the hospital. The nurse asked me, when did you get cancer? When did you feel that you got cancer? Referring to the lump to her breast. She was saying around 3 to 4 months ago, I felt it, but now I can, start to feel pain. That's why I came to the clinic. And the nurse was replying to her, why didn't you come to the hospital back then? I mean, so that kind of, approach and communication can really throw the blame on the patient itself. The patient feel the blame that I have gotten the disease and it is my responsibility now, to go through that alone. And that really can create, fear and depression, anxiety, and many mental health issues to the patients, and can, take them into the place where they are isolated and they don't want to speak about it no more, because they feel that they are not understandable, they are not heard enough. Which can result, in many issues that includes, not adhering to the treatment plan, not, achieving the ultimate best health outcomes out of the treatment, and many other side effects and problems.
So, Majed, that's really interesting to hear. And, you've dropped a few quotes that I'd like to recap for our listeners. And I think it just stood out for me. It's, what are the roles of NGOs? And you talk about the Friends of Cancer Patients. And actually, Joab and I were up in Sharjah a couple of years ago, so it's really exciting to cross paths again. You also talk about, people should just stop judging, and how do we really provide support systems to patients who are living with NCDs? And these are such important elements. You're one of the first speakers that we actually coming across who works in a non-governmental organization. And so, in your opinion, what is it that we can really do as civil society and as an NGO when it comes to tackling stigma and discrimination within our own context, but beyond our context as well?
Yes, that's a good question, Shakira, because again, I was always been saying this before, and I'm going to say this again today and sharing with you guys all. We as NGO, as civil societies, or we some refer to us as patient organizations, we can do a lot when it comes to supporting cancer patients, lifting their spirits, collaborating with different partners, stakeholders. However, we cannot do this alone. We need to really work with different, multi-sectoral entities, establish strong coalitions with, concerned, organizations, because if we want to ensure that we create impactful, campaigns, programs to support those people affected by NCDs, we need to need to get all the people from different sectors on the same table, discussing the issues, addressing the gaps, and from there we can only move forward. We can never work alone. So, and also to hear from people living with NCDs is a very, very important aspect that is now has been taking place. And, we have been working, in meaningfully engaging people with NCDs and cancer patients now more than ever, which is a great steps that that we have been doing in our region. So getting the people involved and engaged and hearing from them, and especially when it comes to engaging them with campaigns and programs, planning, and implementation stages, is very, very critical to have them on board, supporting us, and sharing their perspectives throughout the implementation and also evaluation stage, and trying to engage them in public platforms to make sure that their voices are heard, and ensuring that we are placing them in the appropriate and the suitable platform, because not all platforms might work for or might not get acceptable for them to be speaking about it openly in a safe environment and in a safe space.
Thanks, Majed, and I really, really appreciate all the work you're doing in terms of supporting patients. As a patient myself, I've seen the importance of meaningful engagement and how important meaningful engagement is in terms of it helps us open up, and that community around us gives us the courage, gives us the strength to talk about our stories. So my question is, I feel like when we talk, the stories we say, our stories, help push the agenda along. So in terms of the experience you've had with patients and them opening up, have you seen any impact when they tell their stories, their meaningful engagement? Because I know it's a concept that's recently come to the center stage. What has been your experience with meaningful engagement and patients opening up? And what would you say to patients who haven't yet gotten to the point where they can tell their stories?
Right. So in the past, years, in the past decade, I believe that people were not, very willing to speak about their disease and their illnesses, again, to surround, to the stigma or, the misconceptions that surrounded cancer that's already existed, unfortunately, before. But now people are speaking up. They are, trying their best to help others. And, I feel that, patients, when they are aware and they know that their voices can make a change and it can make a difference, they are more encouraged to share their stories. They're more encouraged to speak openly about all the challenges that they have been facing in the past, and what they were, looking or asking from, the healthcare system or the patient organizations or the community, to have a better insight about the challenges that they have been facing, and how each individual or each organization or authority could have contributed to minimize the impact of the challenge that they were facing throughout the journey. So it's very important for them to empower them, to lift their spirits, and tell them, guys, you have been experiencing such difficult disease, and we want to hear from you. So this welcoming approach and encouragement can really help them to open up and speak up and share their experiences with others.
So Majed, as we're about to wrap up, we've heard quite a bit from you, which has been really exciting, listening a little bit about the context, the type of work that you're doing up in the UAE and other parts of the Middle Eastern region as well. But also then shifting a little bit into actual myths and misconceptions around people living with NCDs, the different types of cancers. I mean, I've worked a very long time in cervical cancer, and it's quite interesting to hear about the stigma that's related to that as well, in terms of being promiscuous, etc. So I think that's really, really exciting. Thank you for joining us for this podcast. But as we wrap up, let's shift the spotlight back to you as an activist, as an NCDChild young leader. Tell us, what's your journey? How did you get into the NCD space? And why are you working in the NCD space? What really keeps you going in the field?
Right. So I'm sure the Young Leader Program has provided us with such a great platform for young leaders to be engaged in the NCD space. I mean, coming from a background of medical sciences and public health, I have been quite involved in such area, and moving later on into my career as a patient, as a representative of a patient organization. It has really enabled me to to do whatever that I'm doing for a really amazing cause, which is supporting cancer patients in my community, which is, I find it every day a very noble cause. And this is basically what keeps me going and motivates me to give more and, support. Some people might consider them, as a vulnerable group in our communities, but I feel that they are very powerful, and they can really, really create better change in our communities. And going back to the stigma and discrimination, I believe that cancer patients themselves can break the stigma surrounds cancer in our communities themselves. We can bring on board experts, public health workers, many people from the field, but hearing from the patient themselves and enabling them to share their voices in different platforms can really create impactful impacts today.
A massive thank you, Majed. I think you've really touched on so many issues, which we leave this conversation with. The most powerful is exactly what you just said, and no bias intended there, but what's the role of patients themselves in standing up and speaking out against stigma and discrimination? There's immense power within that, and how do we harness that? You've spoken about strong collaborations in the civil society space, which is needed. And a couple of other quotes which you've thrown at us is stop judging people. I think that's quite important, and patience. And finally, building very strong support systems. It's been excellent hearing from you, having you as a guest, as an advocate on our last and final episode. To those who've listened in, we've had Majed Mohammed, also an NCDChild young leader, also affiliated with the Friends of Cancer Patients, join us. From myself, Shakira, Choonara, and my co-host, Joab, Wako, we thank you for listening to the NCDChild podcast series, which we've titled Stand Up and Speak Out. It's really the beginning of this journey on stigma and discrimination. Stigma and discrimination is so difficult to see, to measure, to address, but it's highly important within a patient's healthcare journey and within our healthcare system. So thank you for joining us. And we do hope that if this is one of the episodes, you do go in and check out all the rest of our episodes as well. Adios, over and out from the NCDChild Young Leaders team.